Hi, I'm Todd Nelson. I've been seeing many thousands of people over the past 34 years throughout Colorado, and on a daily basis, I see people that are having difficulty with blood sugar issues, and they're having problems getting control on their blood sugar and getting their blood sugar numbers more optimal. Now, this might be you. Maybe you've been recently diagnosed with prediabetes, maybe you have diabetes, maybe your glucose is climbing, or your hemoglobin A1C, which is a primary marker in the blood, starts showing that it's climbing a little bit, or perhaps you're even in that diabetic range and you're getting really concerned. Maybe you've gone the conventional route and you're doing some medication, maybe some dietary changes, hopefully some exercise, but maybe you're not really breaking through. Maybe those numbers are not going down like they should be. And maybe that's why you're seeking a natural alternative. And that's very, very good because as a naturopath practicing functional medicine, within the realm of functional medicine, we have many, many tools, many lifestyle programs that are highly researched that help people get better control on their blood sugar. Now, if you've tried to do this on your own, and maybe you very sincerely, very committedly looked at how do I change my diet? What dietary supplements do I take? What kind of exercise might be right for me? And all those things are vitally important. But sometimes it gets confusing and overwhelming, and you start reading all sorts of things on Google and picking up books on blood sugar control and trying to talk to different people. And maybe you're ending up with lots of information, but not really knowing how does that really relate to you personally. Well, again, my job is to help you sift through all of this, and today we're going to talk about some of the underlying causes of blood sugar imbalances. How do you find out if you have some of these causes? What do you do to uproot them and start hopefully reversing that trend? So let's talk about this a little bit. Again, I mentioned you might have prediabetes where your A1C is just climbing up a little bit. You're not in that diabetic level yet. Maybe your numbers are like 5.7, 5.8. Or you have full-blown diabetes, and maybe you're in the early stages of that, or perhaps you've had it for some time. And maybe you've also had something called metabolic syndrome. Metabolic syndrome is something where you have insulin resistance, where you have enough insulin, but your cell membranes are not taking up the insulin correctly, so your sugars are starting to climb, and you're going into this insulin resistance where the cell membranes are dysfunctional. And then other things are happening as well. Maybe blood pressure is climbing. Maybe you're gaining weight around the center of your body, in your belly. Maybe your cholesterol is going up and you're starting to show some cardiac risk. That's all under the umbrella of metabolic syndrome. If you're going into metabolic syndrome, you have a 50% higher chance of developing heart disease and diabetes. Now, most of the time, of course, when you're suspecting these problems or you've been diagnosed with them, you start thinking about your nutrition. And your nutrition is number one. Now, there's lots of different diets that are promoted for trying to control blood sugar. But are they all effective? Not necessarily. Even, in my opinion, the American Diabetes Association diet is quite outdated. Usually what I recommend is a modified Mediterranean diet that I shape to your personal needs, body type, body composition, and your tastes, as well as your metabolic rate. So all those things we have to specifically measure and then begin to look at how do we personalize a food plan that really fits for you to start keeping your blood sugar much more even throughout the day. Now, exercise, hopefully you're doing some exercise, whether it be just simply walking, getting out there every day and putting in 30 minutes. What does that do? It creates demand for sugar and demand for insulin. It helps you burn it more effectively. Now, if you're not doing that already, please start. The next level up is getting to aerobic activity where you get into your personal training rate for your heartbeat. And that really helps optimize how well you burn sugar and burn fat. If you're overweight, controlling your blood sugar can be much more tricky. So going more toward your ideal weight is going to be quite vital. Now, a lot of people don't know this, but stress really plays into how well you control your blood sugar. If you're really stressed at your job, your marriage, your relationship, maybe you're in transition in your life, you can start getting flooded with stress hormones and other stress chemicals that can sort of blunt the insulin and blood sugar uptake. And this can make controlling your blood sugar really, really more difficult, even if you're eating well and exercising. So one of the things we do is some functional medicine testing to look at your stress hormones from your adrenal glands, maybe neurotransmitter imbalances, and look at how does that play into your particular blood sugar situation. Even genetics, sometimes diabetes, prediabetes, metabolic syndrome runs in families. I see whole families that have these things going on. And a lot of times that's because you have genetic underlying issues that may predispose you to being more sensitive to having abnormal responses to sugar and insulin. And there's some simple ways now to start testing that and revealing if you have any particular unique genetic variants that are unique to you. Now, here's something that's very little known. This is based on very recent research in the last couple of years. Many doctors and other health professionals are not talking about this yet, and that is environmental toxicity can actually predispose you to blood sugar imbalances. So if you're exposed to pesticides, herbicides, industrial chemicals, all of this can have a negative impact on your pancreas and a negative impact on your cell membranes that have to take up insulin and balance your sugar. So when I'm doing an intake on somebody, I ask them, do you spray your garden? Are you using pesticides out on your lawn? These kinds of things. Are you working in an industry where you're exposed to chemicals that we suspect? And how do we detoxify those if you are? Very, very important to try and get your cell membranes really responsive to sugar and insulin. Now, a lot of people are getting a lot of added hidden sugar in food. And that's where you have to start really reading labels and saying, like high fructose corn syrup is one of the most poisonous sugars, if you will, in the potential diet. They're high in sodas, for example, and this can be really challenging your ability to keep your sugars level. So we've looked at many different things: nutrition, exercise, stress, environmental toxicity, genetics, hidden sugars, even artificial sweeteners. They're very sweet to the taste. They might not have any calories. They might be indicated for diabetics, but recent research says the more of those you eat, the more it might set you up to crave sweets. And then you get on this roller coaster and you're eating the things that are actually getting in the way of you balancing out your blood chemistries. So even getting rid of artificial sweeteners is very, very important. Now, most of you watching this have maybe tried different dietary supplements, and there's thousands of them on the market that make lots of claims about balancing your blood sugar. But the truth is, most of them don't have good scientific research, they don't have clinical trials, they don't have really good quality control. It's sort of hit and miss. Maybe you've already had that experience where you've tried this and that, you spend a lot of money, you get kind of frustrated, and the bottom line is you got to have your chemistries and your tests actually showing that you're improving. So you might be hitting the wall with this one. Now, in functional medicine, we have access to very sophisticated, highly researched, highly quality controlled supplements that are shown to help balance out your blood sugar during the day. For example, one of the products that I use has been researched at the Joslin Diabetes Center at Harvard. And it's a drink that, pleasant tasting drink that you drink. It has a very specific kind of protein and starch in it that helps keep your blood sugar very, very even through the day. This is only available through health professionals. So I've just told you a lot, and when you think about it, it's a lot to put together on a daily basis in your daily health habits. And how do you do that? When you're trying to synergize all these things into a program that works for you, you can get very overwhelmed, you can get very frustrated, right? So what the heck is the answer? Well, the answer is both simple and complex. A very personalized program for you is really the answer, because one size doesn't fit all. You might read a book where the author says, oh, do this program and you're going to get your blood sugar really balanced. Well, it might work for 40 or 50% of the readers. The other 60 to 50% is still struggling with balancing their blood sugar. Why is that? Well, probably because you haven't taken into account everything that could be factoring into the causation of your particular blood sugar issues, and perhaps you need very sophisticated food, exercise, and supplement plan with some stress reduction to really start shifting around your metabolism and getting real outcomes. The good news is I've seen people who really take on a lifestyle program with a lot of these functional medical research programs actually normalize their sugars and their numbers in their blood over time. If you're interested in this, I'd really like to invite you to do a 15-minute free consultation with me where I can carefully listen to what's going on with your particular situation. Think about if there's any tests you haven't done yet that you might need to be doing, and then start making suggestions as to how to start a program, and then find out maybe a little bit more underlying causes, and then how to personalize it to you in a way that you can do in your personal life on a daily basis. All you have to do is just put in your name and your telephone number and your email address right below this video, and one of my staff will get in contact with you and set up a free 15-minute consultation with me, either via the phone or via Skype, or you can come into the office and we can meet, and then I'll be able to do an hour-long intake on you, find out what tests you need, and then look at starting a program. So, in the meantime, I hope you're taking care of yourself the best way that you can, and I hope you're doing as well as you can be. Until next time, stay well.